for chair for duration of the meeting, and I need that moved and seconded, please.
Can I move Majid Hussain?
I'll second that.
Thank you very much. We'll need to take a vote on that. So Councillor Fielding, do you agree?
Agreed.
Councillor Moores?
Agreed.
Councillor Chowan?
Agreed.
Majid?
Agreed.
Dr. Milnes?
Agreed.
Ben Gilbraith?
Agreed.
Thank you very much. Over to you, Chair.
Okay, thank you very much, Laurie, and really good to see colleagues, albeit on the screen. So if you just indulge me for a couple of minutes, I'm just going to read from a script just to outline how we vote, how we make a decision, and in case there's a technology failure, the sort of process we follow from there. So the meeting's being held by virtue of new regulations introduced by the government. The regulations have temporarily removed the legal requirement for local authorities to hold public meetings in person. This will enable councils and partners to make effective and transparent decisions on the delivery of services for residents. The requirement for public meetings to be made accessible to the public remains, and the link to the virtual meeting is available on the council's website in the usual live meeting link page. If a connection to a member is lost during the meeting will be stopped to enable the connection to be restored. If the connection cannot be restored within a reasonable time, the meeting will proceed, but the member who was disconnected will not be able to vote on the matter under discussion, as they would not have heard all the facts. Should any aspects of the external link fail, a short adjournment may be called of up to 5 minutes or so to determine whether the connection can be quickly re-established, either by video technology or telephone in the alternative. If the connection is not restored within that time, the meeting will be adjourned and any further business will not proceed until another time and date. Any public questions properly submitted to the meeting during this period will be read out by the chair and answered at the meeting. So our first job, Laurie, can we ask the members to confirm their attendance?
Yes, we can. Councillor Fielding?
Yeah, I'm here.
Councillor Shah?
Present.
Councillor Chowan?
Present.
Councillor Moores?
Present.
Majid Hussain?
Present.
Dr. Patterson? I didn't see him join yet. Dr. Milnes?
Present.
Ben Gilbraith?
Yep, I'm here.
Thank you very much.
Brilliant. Thank you very much, everybody, for that. So we've also got officers in attendance from the council and the CCG, and I'm sure they'll introduce themselves as they speak. So when the board comes to take a vote on a report for approval, Andrew Vance is here as well.
Yep.
Yeah, brilliant. So when the board comes to take a vote on a report for approval, each member will be individually asked to state whether they are for or abstaining. When a report is for noting, it will be asked if a member does not agree. As with ordinary commissioning partnership board meetings, once the exclusion of the press and the public has been moved at the meeting to enable the board to discuss private reports, the press and public will no longer be able to view the meeting. If we can now turn to the agenda, and for the benefit of those members of the public watching, the full agenda pack is available on the council's website. And just to confirm, Dr. Shelley Gumbridge is also present. So item 2, John Paston is also joining us. So item 2 is apologies for absence.
Chair, we've received apologies this afternoon from Claire Smith, Helen Lockwood, Rebecca Sutcliffe, Dr. Gopi and Gerard Jones.
Okay, thank you very much. We move on to item 3, around any urgent business. I've not been notified of any urgent business. So we move on to item 4 then, which is declarations of interest. Any New declarations of interest. Anyone? Any changes since the last meeting?
Yes, Chair.
Okay, John.
So I've been appointed to the NHS Advisory Board for Health Inequalities.
Okay, brilliant. Thank you very much, John. Any specific conflicts with any of the agenda items today? No. Okay, brilliant. Let's move on then to item 5, which is any questions from members of the public?
Chair, we've not received any questions.
Okay, thank you. We move on then to item 6, which is the minutes of our last meeting, which was held on the 23rd of July. So I'm not going to go through them page by page, but I'm just going to check with everybody that these are an accurate record of the meeting. So if anybody doesn't agree, if you can let me know. Otherwise, I'm assuming we're in an agreement. Okay, good. So we move on to the first item. I'm going to hand over to Mark, who's going to talk to us about the Integrated Health and Social Care Brokerage Framework. Over to you, Mark.
Thanks, Majid. Hello, everyone. I'll try and take you through this. So the purpose of this report is to request the board's approval for the implementation of a framework to actually ensure the administration of direct payments where a broker is required, and to ensure that it's managed in line with the specification that's attached to the report within the pack. So the brokerage arrangements actually cover the administration of direct payments for adults, for children's services, and for the CCG, where people are actually choosing to take personal health budgets. So what does that mean in reality? So basically, as you're probably all aware, that as a consequence of the Care Act, the local authority is required to undertake and has a duty to undertake assessments where people appear to actually be in need. So basically, what we will look to do is a social worker will go out, meet an individual, an Oldham citizen, have a conversation around their needs. We look to take a strength-based approach and plug them into communities and help people to actually engage with communities where we can. Where people are struggling with short-term issues or health issues, we try and take a rehabilitation approach, either through our reablement type services or therapy type services. But following those interventions, if a person is still eligible for care needs, there are 10 eligible areas set out within the Care Act. And if that person still has the requirement for support in those areas following those interventions, then we have a legal duty to actually work through how we actually support the person to meet those needs. And that results in the legal requirement to actually produce a care plan, a support plan. And once that support plan with outcomes has actually been agreed with the person, we then also, every locality in the country, it's the same issue, has a legal duty to actually add a financial value to the level of care that would be provided, and that's called a personal budget. So the person then has the choice to arrange either for the local authority or the CCG to actually commission those services on the person's behalf and arrange for them to come in. So a typical example would be home care, if somebody's struggling to actually get ready and go to bed, those type of things, and we would commission it on their behalf. Or alternatively, the person has a right to actually take the value of the personal budget, the financial value on the support plan, and use that to actually commission their own support. They can use it how they wish, but they still need to be able to demonstrate that they meet the outcomes on the support plan. Now, what happens in effect is that once you become a direct payment recipient, you will often become an employer. So in effect, you may choose to commission services or people in the form of personal assistance to actually undertake that care on your behalf. And therefore, as a consequence, you will be required to actually, as all employers do, you will have to run a payroll system. You'll have to ensure as an employer you have liability insurance. You'll have to ensure that there are terms and conditions and all the issues that go along with employing people. The direct payment recipient has those responsibilities. And for many people, that's actually off-putting. For most people who are in a position where they need care in the first place, they've already been through difficult times. And the thought of becoming an employer and all the issues that go with it can often put people off. So localities across the country enable the use of brokers. So a broker is appointed, so the person receives the direct payment, and a broker is appointed to support that individual to actually undertake all the employment and coordinate the care that they need. So that's where brokers actually come in. In terms of, at the moment, we have at any one time between 900 and 1100 people who actually choose to take their personal budget in the form of a direct payment. And since 2012, Oldham has really progressed the personalisation agenda as a form of choice. So if people don't want to actually use conventional or services organised through the CCG or the local authority, they can choose to do it themselves in whatever way that they want to do it, because they believe it gives them more flexibility. In many cases that does. So we have between 900 and 1100 people at any one time who actually choose to take a direct payment, and more than half of those need support with a broker in terms of how they actually enable the support, access personal assistance, and so on and so forth. And this is an area where we have absolutely no framework in place to be able to support those individuals. So there's no framework in place at all between the council and the CCG and the brokers. And the cost is over £500,000 to the local authority predominantly as it stands at this particular point in time. So that's £500,000 of public money where we have no regulated framework in place to ensure how we're using that money to support brokers. In 2016, some people may remember, we brought a report through to Cabinet requesting approval to tender for brokerage. And due to some technical difficulties that resulted in a legal challenge, we weren't able to progress with that, and we revisited where we were up to with brokerage. And therefore, the purpose of the paper today is to actually seek some more influence over the kind of rates that we actually pay for brokerage type of support. So the main 6 brokers that people commission to support them all charge different prices for different things. And we pay for that in addition to the value of the direct payment people receive. So we have 3 options. We can either retain the existing approach, which is no framework whatsoever. We can actually cease to provide any form of brokerage service whatsoever. So the bottom line is, the interesting part is that whilst we have a legal duty to actually offer a personal budget following assessment, we do not have a legal duty to actually offer brokerage services, and I'll come back to that shortly. Or the third option is that we actually tender the proposal to actually put a framework together with clear prices and a clear structure in place to actually enable people and to protect people to use brokerage services that have an oversight of how they actually operate. Lot 1 on the service specification, which is embedded within the park, actually looks at the support plan itself. So to support the individual to translate how they will actually make the support plan come alive. Lot 2 actually looks at implementing the support plan. So how do they identify a service, a provider, or an individual to support them? Lot 3 is for payroll only. So for some people, they may choose to do this their own way with family members or friends, but they can't administer a payroll system because obviously there are HMRC rules to this element as well. And therefore, lot 3 is for payroll, and lot 4 is for terms and conditions. I think probably as all of us on this call and on this meeting are more than aware, then there are terms and conditions and employment rules related to the way in which people employ PAs. So what we're looking to do is seek approval to actually start and commence with the framework along the lots that I've actually set out below. And then the final point is just to make everybody aware in terms of the board and make everyone aware that whilst we're actually progressing with this at this particular point in time, we do feel that the existing service users that we actually have between 900 and 1100 at any one time, we have that duty to try and regulate and provide a safer brokerage system for people who receive the service now. However, we will be looking at this going forward in the light of the financial challenges that the council faces. And therefore, this may be subject to further review further down the line as the council looks to meet its budget requirements. So that's the overview in terms of the paper. I'm Majid, open to questions and issues.
I'm going to bring in Councillor Chauhan.
Can I remind people we're still in the public part of the meeting as well?
Yeah. Thanks, Laurie.
Thanks, Chair, and thanks, Mark, for giving a detailed overview. What's really important as part of our ongoing work, that as administration we wanted to make sure that direct whatever we do, that it doesn't have a direct impact on the service users. So essentially it's important that we streamline things, we create the frameworks, we reduce the administrative costs wherever is possible, and wherever is possible still giving people the choices. But key thing for us is to ensuring that people receive the care they need and we meet their needs. And this paper is again the reflection of that. So I'm asking colleagues to support it.
Okay, thank you very much, Councillor Chauhan. Yeah, as Mark was speaking, and yourself, Councillor Chauhan, and when I read the paper, the thing that was sort of going through my mind is this continuity. So whatever brokerage services that people are using at the moment, there'll be no disruption to their care, or there no disruption to their care or the quality of care as we transition to this new framework. Mark, you want to say something? Or you just...
It's just one of the things that we would, this shouldn't be, no. But the issue is that obviously we'd only be looking to recommend brokerage providers who have gone through and are on the framework.
Yeah, okay. And then we've got a question also from Dr. Vance, who's asking, why does the cost of the brokerage not come from the payment itself, as it's part of the cost of any package and is included for those who do not take personal funding and have a payment for other clients? And he's saying it's just a parity query.
Yeah, thank you for the question, Dr. Vance. In terms of that question, it's one we've asked ourselves many times. So the response is as follows. So people actually take this in the form of a direct payment, and the direct payment is just over £10 an hour. So by the time that the person has actually been paid, there is no further, in terms of the direct payment recipient having a sufficient hourly rate to be able to commission staff, we have a duty to ensure that the value of the payment is sufficient to meet the identified needs. And the bottom line is that the hourly rate that we pay does not factor in any of the additional requirements of being an employer. So we'd either need to lift the hourly rate to actually respond to the enhanced support that's required to actually hire people directly, or we look to pay on top. Or thirdly, as we actually move forward, do we actually build this into, sorry to be technical here, but we have something called a RAS, a resource allocation system. And most localities use this, indeed Rochdale does. And for want of getting overly technical, and many apologies for doing so, once we've actually completed an assessment, we actually use a resource allocation system, and that uses algorithms to actually calculate the value of the personal budget. And the way that the algorithms are actually set up only factors in the direct cost of the care, not any overheads associated with actually employing people. And therefore, that's one of the decisions that we actually need to look at going forward, as we have no legal requirement to actually provide brokerage services. Is this something going forward and in the future for potential new recipients of service that we want to carry on doing? And that's forming part of a wider review.
Okay, Mark. Andrew has got a follow-up question. Does that mean that the other services get a higher hourly rate?
Yes. So basically, I may be misinterpreting the question, Dr. Van, so please correct me if I am. But basically, the hourly rate for a direct payment recipient is nearly £4 less than that of a contracted commission provider. So if the local authority or the CCG were to contract a home care company, for example, we would pay more per hour than we would if we were paying for a direct payment, because obviously what we're recognising is that that company will be charging overheads on top of its directly incurred costs for the carers.
Okay, thank you very much for that. We're about to move into the item 8, but before I do, it was remiss of me not to mention a couple of things. So first thing, a huge congratulations to Dr. Chauhan and Dr. Gumbridge, who were recognised nationally amongst the top 50 GPs who have made a significant difference during COVID, which is a huge achievement and recognition of the amazing work they've done now. I don't know how many GPs there are in the country. I don't know if John or Dr. Chauhan or anybody else knows, but John, you're on mute.
84,000.
84,000, wow, so that is a phenomenal achievement, and we are hugely privileged to be amongst some great colleagues who can be recognised amongst the top 50. So thank you very much, and a huge well done to you both. And also Nicola, who got appointed as the Director of Commissioning earlier on this week. So I forgot to mention that. So huge well done to Nicola also. Okay, we're now going to move on to item 8, and lots of people congratulating colleagues there on the chat. So the next item is the exclusion of the press and public. So can I ask for this to be moved and seconded?
Move, Chair.
Second, Chair.
Okay, so this is agreed.
So agreed. Right, so if we can wait